Hey, good morning, everybody. Welcome. Welcome. Happy Monday. Welcome to my little live cast here on the Surdentity channel. Surdentity is about serene dentistry. And I've based my philosophy on the Serenity Prayer, which asks for the courage to change the things I can and the wisdom to know the difference. And my wisdom comes from experience. And all I've ever wanted to do is to share my experience with my fellow professionals. I have found a way to stay happy, serene amid the challenges of daily dental practice. So, as things are changing fast in our profession, right, with changing legislation, changing roles, and what I see a lot of is as dentists are retiring, their practices are being bought up by non-dental people. And the idea seems to be to conglomerate these practices into more of a corporate sort of a setting. And I really wish that there was a way for that to work. I keep thinking, hoping, I'm optimistic that someday somebody's going to figure it out, how to make a corporate situation work so that patients don't feel corporatized, so that they don't feel like a number. But my message today is about what I can change. And the only thing that I have any control over is my attitude. Is how do I view and approach the situations that I come into? And especially, how do I approach the people who are on my schedule, who are there for my care? I've learned a whole lot over the years about post-traumatic stress disorder, dental fear, and also about the airway. And I have found that most dental fear is related to the inability to breathe. And patients who can't breathe in the dental chair are going to come in a hyper aroused state, and they're going to be controlling of the situation, and they're going to want to manage the situation because they're afraid they can't breathe. This can demonstrate in all sorts of presenting behaviors that can be objectionable. Some patients will present as belligerent, hostile. Some patients can be argumentative. And if I view those people as trying to tell me how to do my job, or trying to make my day harder, or trying to do anything against me personally, it's going to be a difficult experience. What I learned over many years is that I have to change my attitude. I have to let go of judging and labeling, and I have to make a point to relax myself and approach every patient with as much equanimity as I can. That, I have found, goes a long, long way toward having a better experience. And that's what we're all after, right? We're all after a better experience for the patients that we're caring for, but also for ourselves. I realized that I created a lot of my own suffering by labeling a patient and reacting to what I perceived their label as. I found that after asking a few questions and getting some more information, that I was wrong in my label of this patient. And we both had a better experience. So I just wanted to come on here today and talk a little bit about what Surdentity is. And I hope that that we can see each other in real life, and that I can be of help to whoever wants help. There is no reason for any of us to be suffering in our daily jobs. And I would love to help anybody who wants to reach out to ask for help. So everybody have a great day. Thanks.